everybody, thanks for stopping in. My video today is how much does TOS or thoracic outlet syndrome affect the muscles? And I think it affects the muscles a lot. In my case anyway, but I've had it for about 35 years now. And I think the longer you have it, the more that it affects the muscles. I've read stories of younger people getting diagnosed and having surgery right away, and they seem to be pretty good after. And I think the reason for that is it hasn't affected the muscles that much yet. Like, I went for like 11 or 12 years before I was ever diagnosed and had surgery, and I think that's why my surgery wasn't very successful. Because I think what happens is when you go for years and years, you know, TOS affects the nerves, but the muscles go into spasms to try to protect those nerves, especially up here in your shoulders and your neck, upper back, all that. And after those muscles are in spasms all the time for years, I think it restricts the circulation, and the muscles get kind of hard and they get kind of unpliable and stuck together. And that's like in my case, that's why my movement got so bad. That's that's why I call myself the Tin Man. I used to be so stiff I could barely move anymore. So just from, you know, years and years of TOS. So like if you're young and you get diagnosed right away and you have the surgery and they remove some muscles, or sometimes the top rib there, that kind of opens up this area, and everything's pretty good. But I think if you've had it for a lot of years and the muscles get really tight, then they can take muscles out of your neck there or the rib, but you're still going to have a lot of areas where you have dysfunctional muscles, like the upper back, or, you know, the elbow, the wrist. Actually, my TOS started out as pain in the wrist years and years ago, and sometimes you hear people talking about double crush or triple crush. It's where the nerves get restricted, you know, in the wrist or the elbow. But in my opinion, I think the nerves can really get restricted anywhere along the arm. If the muscles get too tight, they just kind of get stuck in the muscle, in the fascia there, and then they just kind of get bound up in there, and then when you move around they get inflamed, I'm pretty sure. Because in my case, I've been working on my mobility for about 5 years now, and when I first started, I just barely do one exercise and I'd have inflammation in my hand for days, and now I'm to the point where I can push pretty hard, and the inflammation is not usually too bad. I still get some, but it's nowhere near how it used to be. So in my experience and in my opinion, thoracic outlet syndrome can affect the whole body over time the longer you have it. So it's I found that it's real important, you know, to do things like joint mobility exercises and self-massage, vacuum cupping, anything to try to keep the muscles loosened up and soft. If they start spasming all the time, they get tight, and if you get where you're in pain all the time and you don't move over a long period of time, you can't move anymore. I found that out by experience. So that's my video today. Thanks for watching, you guys, and I'll talk to you next time.